Ma'am, you can start.
नमस्कार, शुभ प्रभात। आज 9 मई मातृ दिवस के दिन, वर्ल्ड मदर्स डे के दिन, और जबकि रमजान का महीना भी चल रहा है, मासिक शिवरात्रि भी है, और ऐसे समय ये बहुत ही अच्छा दिन है जब हम बात करें कोरोना के इस महामारी से जूझने के लिए, जो भ्रांतियां, जो अफवाहें फैल रही हैं, उनसे दूर होने के लिए, जिससे कि हम एक नए उजाले की तरफ बढ़ सके, मन में विश्वास जगा सके। वैसे तो लोग आते हैं, जाते हैं, पर याद वही रह जाते हैं जो दिल से सेवा करते हैं। और इंडस वेलनेस कोर्ट जो है, कोर्ट ट्रस्ट जयपुर, इसी की तरफ हमेशा से अग्रसर रहा है। इसके संस्थापक नरेंद्र बख्शी जी का हमें ये एक उद्देश्य रहा है कि वे मानवता की सेवा के लिए जितना भी अपना समय और संसाधन उपलब्ध करा सके वो करें। इसी कड़ी में हमने हेल्थ और फिटनेस के लिए एक नायाब सत्र का आज आपके लिए लेके आए हैं, जिसमें हमारे साथ हैं अमेरिका की बहुत ही प्रख्यात डॉक्टर लता और डॉक्टर अरुणा सुब्रमण्यम, जिन्होंने संक्रामक रोगों के कारण और निवारण पे बहुत ही ज्यादा अपना कार्य किया है, और कोरोना काल में इनका योगदान अभूतपूर्व रहा है। इनके कई शोध पत्र इन्होंने प्रस्तुत किए हैं, जो कि हमारे लिए एक स्मरणीय और एक बहुत ही प्रेरणादायक चीजें हैं। तो ऐसे इनसे बेहतर कौन हो सकता है आपके प्रश्नों का जवाब देने के लिए। इससे पहले कि हम इस सत्र में आगे बढ़ें, मैं आमंत्रित करती हूँ डॉक्टर लता पलानियप्पन जी को कि वे आए और अपने सहयोगी डॉक्टर अरुणा और अपने स्वयं का आप सबके साथ में रूबरू परिचय कराएं। डॉक्टर लता जी।
Thank you, Dr. Jain. My name is Dr. Lata Palniapan. I'm a professor of medicine at Stanford and founder of the Center for Asian Health Research and Education. It is with great honor that I welcome you all to this ICC Crack the Wellness Code and Stanford Center for Asian Health Research and Education Community Partnership Conference. Since its founding in 2018, the Center for Asian Health Research and Education at Stanford has continued its commitment to research, education, and community empowerment. In 2019 and 2020, CARE provided seed grants to over a dozen researchers investigating topics ranging from traditional Asian medicine to pharmacogenetic differences influencing anesthetic outcomes. CARE has partnered with the Stanford Open Journal System to establish a novel journal for Asian health, filling gaps in knowledge of Asian health burdens around the world. Other collaborations include both domestic and international partnerships, including Arogya World, directed by Dr. Nalini Salagram, the Asian Pacific Fund, the Rutgers Institute for Aging Research, and other international universities around the world. Today's virtual program will allow us to advance our mutual goals of increasing health and wellness in our global communities during the COVID-19 surge. I am so thrilled that today's online platform will allow you to meet one of our most preeminent Stanford faculty in infectious disease, Dr. Aruna Subramanian. Dr. Subramanian is a graduate of the University of Michigan Medical School and completed her internal medicine residency at Case Western and her fellowship in infectious disease at Johns Hopkins. She has published extensively, has received numerous awards for her research and mentorship, and has been featured in the media for her groundbreaking work in COVID-19 treatments. She has been my personal hero since I followed in her footsteps in our combined pre-med program at Stanford at University of Michigan, and she continues to provide inspiration and inspire admiration in fellow professors, students, and patients alike. Today, we have the unique privilege of hearing from Dr. Subramanian, who is a leading expert in the field and has served tirelessly on the front lines of COVID for the last 15 months. The topic today is top of mind for everyone: COVID prevention and treatment when resources are limited. We are saddened by the current COVID-19 surge in India and are gravely concerned about the reports we are hearing from our colleagues, families, and friends. Having spent the early part of my career with Doctors Without Borders, I know firsthand how hard it can be when you don't have the best medical care at hand to provide evidence-based care for every patient in front of you. India to date has reported 23 million COVID-19 cases and 250,000 deaths due to COVID. We were heartened in the early days of the pandemic. India appeared to be paradoxically protected from the ravages of the pandemic, even when areas around the globe were experiencing high case and death rates. There are currently 400,000 new cases per day and 4,000 new deaths per day due to COVID in India, an all-time high around the world. We are aware that these staggering statistics likely represent vast underreporting, both in terms of morbidity and mortality. We are empathetic and sympathetic with the current crisis, having faced it ourselves in a smaller scale in our community in Silicon Valley just 6 months ago. We also want to provide some optimism today. 98% of people who are diagnosed with COVID-19 recover well. Yet, we know every family in the world has been affected personally by this global pandemic, and the full repercussions are not yet fully known. Given the lessons we have learned and continue to learn daily, we will share our evolving knowledge to connect our colleagues and communities around the globe. Today's talk will cover what to do if you or a loved one is diagnosed with COVID, how you can keep you and your community safe, and how to best treat COVID-19 when resources are limited. Please join me in welcoming our keynote speaker, Dr. Aruna Subramanian.
Thank you so much, Dr. Lata and Dr. Rashmi. I'm really honored to be here. And I would love to say wonderful things about Dr. Lata. I've known her for many years, and she is an amazing physician and researcher and has done so many amazing things. So she's very humble to begin with. So thank you very much, Dr. Lata. And I'm really here to answer questions and really discuss topics that are top of mind for everybody who are, I know it's been very, very difficult for everyone dealing with COVID-19. So I'll just lay the groundwork. We started seeing patients with COVID-19 last March when people started coming to the hospital in March 2020, and they were suddenly getting sick. And we learned so much. We've changed some of the ways we practice. In fact, early on, we thought it's better to intubate people and put them on the ventilator very early. And now we've learned so much about how to wait and only use the ventilator when it's absolutely necessary. And I know resources are limited in India. And so it's very, very important not to waste those resources on people who don't really need them, because the majority of people with COVID-19 may either have asymptomatic infection, so they don't even feel the infection, or they may have mild symptoms, more like cold symptoms, fever, headache, and change in their taste, low appetite. But those people don't need blood tests or CT scans or even oxygen. It's as people start to develop moderate to severe symptoms, when they start to get short of breath, when they can't speak in full sentences, when minimal exertion really gets them winded, when we have to think of what types of interventions, how to keep an eye on them carefully, decide really who needs oxygen. And even some of them can be managed at home very successfully, and really use the hospital as a place only for people with very severe disease, but not wait too long. The key is to keep an eye on people and really understand what are the things to look for in order to take them to the hospital. When should you really try to look for a hospital bed? So I think we'll be talking more about this. We can go to the questions and talk about how, how to address, what can you do at home really to get through this?
So thank you, Dr. Subramanian. If we can bring up the slides with some of the questions, and maybe I can start with just talking about, you know, what are the first things that someone should do if someone in their family is diagnosed with COVID-19? You know, we're all able to get tested so often. It's quite affordable now. And in the early days of the pandemic, we weren't even able to get reagents to do the testing necessary.
Right.
But now at least, you know, we can test. So let's say, you know, your child comes home with a COVID positive test. What are the next steps?
Right. So the things that you can do at home, of course, like any type of viral illness, you take rest, you drink lots of fluids, and then it's very important to try to prevent that spread within the house. So if it's possible to quarantine, stay in a separate room if possible. If not possible, then even masks in the house. Make sure there's enough ventilation. Don't keep the air conditioning on and keep all the windows closed. Really open windows, even if it's hot outside. Really get the airflow moving and stay home and rest. I think that's so important. You can use fever reducers, that is paracetamol or Brufen, anything to really help you symptomatically, cough suppressants. And then I think the thing to do next is to purchase an oximeter, a machine that will tell you what your oxygenation level is, especially if somebody's getting more short of breath. They have to have help at home to keep an eye, make sure if they're not able to move around, do simple things like if they get very winded, just going to the bathroom or talking. Those are the people where you really have to keep a very close eye on them.
Thank you, Dr. Subramanian. And do you recommend that when people have COVID-19 and are feeling short of breath, for them to sleep on their stomach or their back?
Yes, that's a great question. I think something people can do at home is called proning. So you sleep on your stomach as much as possible. And if it's difficult to sleep on your stomach, then at least lying on your side can really help. It helps the blood flow and the mechanics in the lungs. And so I've seen it work even for people with more severe disease in the hospital. I've seen people avoid getting intubated by sleeping on their stomach. Of course, you'll have to turn over to eat or to use the bathroom and other things, but as much as possible, as many hours as you can handle it, if you can sleep on your stomach. That's called proning, and it's very helpful.
Wonderful. And you mentioned buying the pulse oximeter, which you put on your finger to test your oxygenation. And in the studies that I've seen of being on your stomach, which is better versus on your back, is it almost results in a 10% higher pulse oximetry rate, oxygen saturation. And then there are some other numbers on the pulse ox. And so I wonder if you clinically pay attention to those numbers, or what is the level at which you might ask people to seek more medical attention.
Right. You know, there are other numbers there. What we really look at is the respiratory rate. So how fast is somebody breathing? When it gets above 24 is when people are really sort of starting to gasp for breath. And the other number that comes up is just the oxygen saturation. And people sometimes they like to see numbers of 99%, 97%, but you don't need such high oxygen saturations. Really, anything above 90 to 92% is very safe, and you don't need to try to purchase oxygen cylinders unless you're consistently lower than that in the 80s. So if you could, especially if you can prone and sort of get through without getting extra oxygen, if you can keep it above 90 to 92%, then that's ideal. If somebody is starting to drop below consistently into the 80s, that's when you really should at least try to get oxygen or seek further help, further medical attention. The other thing that can be done, maybe we'll get to that, is in inhaled medicines, but we can talk about that afterwards too.
Okay, wonderful. Dr. Jane, would you like to translate at all up to this point?
Oh, you're on mute. You're on mute.
Dr. Jane, you need to unmute yourself.
There is a lot of myth regarding the use of the pulse oximeter because the people, they have seen that there are various readings, variables are seen while using the pulse oximeter. And particularly if you are using on different fingers of the different hand. So would you like to comment on it? How to use it properly? What is the proper way of using a pulse oximeter?
Yeah. Lata, you were reading that the middle finger, right?
Yes, so the WHO recommends the middle finger of the right hand, but it is mainly to just provide some consistency, but really, you know, any finger is fine. You know, make sure your finger is warm enough. You know, you don't want it right next to the air conditioning and then trying to measure the pulse ox. But the middle finger of the right hand is fine. And then we don't really, and there is some variability in the perfusion index. And I know the pulse oxes report it, but you don't really need to pay attention to that. But, you know, watch the oxygen saturation. So you want to keep that number in the 90s. And the respiratory rate, if it gets to be above 24, that's when we really start to worry and people should start to seek medical care at that point.
Very rightly said. Because when we are using the pulse oximeter, it should be fixed properly into the finger with the nail facing upwards towards the red light which is coming. And so that, and there should not be any nail paint or any color
That's
like
what I was gonna say,
on
yeah.
it, or it is too cold, like you rightly said. And then we have to wait for at least 1 minute or so till the readings get stabilized. One should not jump into it that, okay, it is coming less and then worried. No, you have to wait for at least 1 or 2 minutes, let it get stabilized. Thank you so much. The next slide, please.
Oh, one thing I was going to say, sometimes if you walk and your oxygen saturation goes down, then if you lie down and then, especially if you lie on your stomach, you can slowly bring it back up. So it's something that, yeah, it's better to wait and really watch, and it can come back up. It can go up. So
very rightly said. Yeah. Now it's regarding the how to sustain the oxygen level at home, like when we are not moving up or we are not seeking for the medical help at the hospital or the dispensaries, then how can we sustain oxygen level? And what are the signs and symptoms, the warning signs which predict that, okay, in the next 6 hours or 8 hours or 12 hours, we'll be needing a oxygen support or a medical help. And in this, again, there is another, if you don't have the facility for the oxygen support, can something be done at home to improvise?
Yes. Well, I think the things that we've talked about, as we said, proning is ideal. But the other things that you can do at home are inhaled steroids. That has been found to be helpful. So whatever's available to you nearby, it can be helpful. Budesonide is what was studied twice daily. It's usually not harmful. And especially if somebody has asthma or some history of reactive airways, we have found albuterol inhalers can be also helpful. But they're not, none of these are absolutely necessary. It's really just really rest and supportive care. And the things to watch for, as I said, are the rising respiratory rate, the inability to talk in full sentences, sometimes paroxysms of cough that just won't stop, severe chest pains, especially when taking deep breaths, or if the oxygen level is consistently below 90%, then these are things that really should make people seek more care.
And I'll just add, I'll just add a little bit to that, Dr. Jane, and you correctly pointed out that it is Mother's Day, International Mother's Day, today, tomorrow for us in California. And I want to emphasize how important rest is, particularly for mothers who get COVID-19, because mothers are the ones who are always taking care of the family. They might still trying to be cooking, which cooking fumes we know can lead to decreased oxygenation rates. So we cannot emphasize enough how important this rest is. And as Dr. Subramanian said, even small things like going to the bathroom can be incredibly taxing. So it is the time to rest and recuperate. And we need to remember that COVID-19 infection is an interplay between your body's immune system and the infection. So we need to do everything that we know works for keeping our immune system functioning at its best level. So that means rest, getting plenty of fluids, eating, getting nourishment to the extent that you can. So it is really important to keep your body strong in order to fight the infection. I'll also say that there have been vitamins and minerals that have been tested for COVID, including zinc, vitamin C, vitamin D. None of them have been conclusively proven to be helpful for COVID-19, but none of them are harmful. So, you know, to the extent that you feel that this helps you fight the infection, it's not harmful, but it has not been shown to be helpful as well.
Yeah, very rightly said. Now this is what you have already said is to how to know that whether you require a oxygen support or not is a 6-minute walk. If you are able to have the pulse oximeter reading same after a 6-minute walk inside the house, then need not to worry. But if it drops down by 4% or more, then definitely it shows that there is something wrong, your perfusion is not proper. दूसरी बात जो है कि आप यदि बात कर रहे हैं और उसमें हाफ जाते हैं या आप ब्रेथलेस हो जाते हैं तो भी आपको उसमें चिंता करने की जरूरत है। तीसरी चीज है कि आप अगर कुछ भी आपको तकलीफ है तो बेहतर है कि आप ओवर ना करें। अगर आप जिम जाते रहते हैं, कसरत करते हैं या कुछ भी करते हैं, डोंट एवर ओवर एक्सर्ट योरसेल्फ बिकॉज योर ऑक्सीजन डिमांड उसमें बढ़ जाती है और आप ये हालत में नहीं है कि आप उसको सहन कर पाएं और इससे आपकी ऑक्सीजन की जो लेवल है वो नीचे जा सकते हैं और आप परेशानी में आ सकते हैं। वेरी राइटली सेड बाय डॉक्टर अरुणा के इस समय में आप ब्रोंकोडायलेटर्स जो हैं वो ब्यूटिसिनाइड और उसके रूप में ले सकते हैं ट्वाइस अ डे एंड इट इज वेरी इफेक्टिव। उल्टा लेटना बहुत अच्छा है और उल्टा हमेशा लेटें, जितने भी देर आप कंफर्टेबली लेट सकते हैं। इसमें उन लोगों को तकलीफ आ सकती है जिनकी की टमी बहुत ही ज्यादा प्रोमिनेंट है, मोटा पेट, वो बहुत गड़बड़ करता है बिकॉज उनको उल्टा लेटने नहीं पाते हैं, तो वे साइड में लेटें और उससे उन्हें आराम मिलेगा। So let us move to the next question.
Yeah. Can I just say one thing about that? I feel like even 6 minutes is a little bit maybe too much for people to walk. In fact, I would even suggest that people, if they rest, they don't even try to walk for 6 minutes in the house. We do even less of a test, just walking around the room itself to check. Some people even get quite winded after 6 minutes. So
Yeah, I agree.
I
I just wanted to agree with Dr. Aruna, Dr. Jane. I think particularly in this time where resources are so limited with oxygen that even that level of stress of a 6-minute walk test, and it might unnecessarily worry people because they will desaturate, with the 6-minute walk. It's actually, a pretty long time. And sometimes, we spend all day at our desks in front of Zoom and we haven't walked 6 minutes for the day. But particularly, in the early days of infection, first 48, 72 hours, getting as much rest as possible. And people after that should gradually start to feel better. And if you're not feeling better, that's a concern. But again, as Dr. Subramanian said, proning, so lying on your stomach, even that improves oxygen levels by oxygen saturation by 10%, as much as 10%. So taking as much rest as possible and not unnecessarily stressing, even with a 6-minute walk, is what we might recommend.
Very true, very true. And what about the breathing exercises, the deep breathings?
Mhm. That can be definitely helpful, as it's shown there. The only thing is sometimes people start to get more cough, and they get paroxysms of cough, and they're not able to do these breathing exercises. So really cough suppressants and taking slow, deep breaths does help. And especially if you're going to use an bronchodilator or a budesonide or steroid inhaler, then make sure you use it and then do the breathing exercises. That can help quite a bit.
I'll also just put in a plug for pranayama and yogic breathing. This is very helpful and has been shown actually to improve immune functioning in small studies. So, doing some of the yogic breathing can be particularly helpful also.
Mm-hmm.
Should we go to the next slide?
Yeah. Now this is regarding the prescription. Is there any age-wise prescription, or prescription remains same for all age groups? And what is the role of the standard prescription? Like where there are 2 or 3 or multiple antibiotics and multivitamins and anti-allergics and paracetamol or analgesics. So what is the relevance?
Yeah, we actually use very few medicines. In fact, many people who have COVID here, we actually don't routinely prescribe many medicines. It's mostly supportive care. So, and it's really not, the prescriptions are not really changed based on age. I would say they're more based on how people are doing and feeling. So if they have fever and cough, then, paracetamol or Brufen or Dolo, those are all good medicines. And then the vitamin C, D, and zinc, as Dr. Lata said, is more just to boost people's immunity. And we do not recommend antibiotics, unless somebody has a secondary infection, but that's usually in people who are hospitalized and with after they have viral pneumonia, they may get bacterial pneumonia, but that's usually people down the road. We have not seen any benefit to antibacterials like azithromycin and doxycycline. And the studies on ivermectin have been both some positive, some negative. So the NIH, at least in the US, does not necessarily recommend it. They say there's not enough evidence for or against, so we don't really use that. And so the only thing that we use in addition to this is, as I said, budesonide inhaler, and that can be helpful twice a day. So that's the way we approach it. If people are getting worse, at 7 to 10 days is where you really have to watch, and then the rest of the medications that we prescribe are usually reserved for hospitalized patients.
Very well said. Dr. Aruna, as you have worked on the remdesivir, can you comment on it? Means what is the role and the relevance? What should be the dosage and how long it has to be given, and in what setup it should be given?
Yeah, I would say that remdesivir can be helpful to people with severe COVID who are in the hospital on oxygen. And it helps them get better faster and get home faster, get off oxygen faster. But it's really not been proven to be a life-saving. It doesn't really prevent death. So I don't think it's an absolutely necessary drug. If it's available, then I would give it in a hospital setting because it should be carefully monitored. It's an IV drug. It's quite safe mostly, but we do follow people's liver function tests. And it's usually given for 5 days. We did a study looking at 5 versus 10 days, and 5 is quite good for most people. But that I would not, I've heard reports of it being sold at very exorbitant prices and people really going out of their way to get it. And I would say that that is not worth it. It really, if you're hospitalized, then supportive care with oxygen and steroids like dexamethasone are much more important than the antiviral.
Can you comment on from which date or the day of the COVID infection remdesivir is effective? Otherwise, it is not.
Yeah, the earlier you start, if you have severe disease, so if you have less than 11 days of symptoms, then it can be helpful. And so many people who worsen between 7 to 10 days. And if you're hospitalized at that point, then starting remdesivir can be helpful. As you go further and further, then it's less and less helpful. So as you would expect, the early phase is really when you try to control the viral replication, the amount of virus you have. And later in the course of your illness is really when the immune system is overactive and really causing more of the problems in people. So at that point, things like steroids and occasionally tocilizumab in people who are hospitalized could be beneficial. But really it's that immune activation that you're trying to prevent or suppress a bit so that then you prevent symptoms.
Very rightly said. आपने बहुत सही कहा कि रेमडेसिविर तभी इफेक्टिव है जबकि वायरस का जो है रिप्लिकेशन स्टेट चल रही है. एक बार जब वो इम्यून सिस्टम को एक्टिवेट कर देता है तो हमारे पास में साइटोकाइन स्टॉर्म या इन्फ्लेमेशन जो है बहुत सीवियर हो जाता है. उस हालत में रेमडेसिविर का कोई रोल नहीं रहता और उस समय हमें लाइफ सेविंग स्टीरॉइड्स की ही जरूरत पड़ती है. Thank you so much. Now, would you like to give any suggestion for the better management for the practitioners as well as the patients regarding COVID?
Yeah, I guess you're talking better management. I mean, I think people are doing the best they can and really trying their best. But as I said, I think we have to reserve some of the treatments for the people who would really benefit from it and not necessarily reach for all the different medicines you have on your list. I think that there are certain medicines that you can use early on, and then if somebody is worsening, really reserve the inpatient treatments for those people.
बहुत बहुत धन्यवाद. आपने बिल्कुल सही कहा कि हर कोविड पेशेंट को कहना चाहिए कि ब्रह्मास्त्र की जरूरत नहीं होती है, रेमडेसिविर की जरूरत नहीं होती है. वे साधारण केयर से भी ठीक हो सकते हैं, इसलिए बहुत ज्यादा परेशान होने की जरूरत नहीं है. 95% केसेस के अंदर में जल्दी रिकवरी हो जाती है. सिर्फ 5% जो कि बहुत सीरियस है, उनके लिए ही हमें जो महंगे इलाज हैं उनको छोड़ना चाहिए और उसमें हर एक किसी को पैनिक नहीं होना चाहिए. Now, with this, we are moving to the next questionnaire, which is regarding spread of the virus. Is there any evidence of airborne spread of the COVID-19 or its mutant? What is your say?
Yeah. Yes, I mean, we do. So until now, we've been talking about droplet spread, which is mostly what respiratory viruses are spread. When you sneeze or you cough, you have tiny droplets that people that go into the air and other people inhale. But it's it is airborne as well. It's in such a small particles that it can linger in the air, and that's why really good masking and social distancing and good ventilation are all very important parts of prevention.
I'll take the next ones. How can one protect themselves when taking care of a family member who are undergoing home quarantine treatment? And it's very important, and I'll echo what Dr. Subramanian said earlier, to wear masks in the house. So there have been many studies that in influenza actually that have shown the efficacy of masking in the house, even when you're with your family members, when someone has tested positive for COVID, also washing your hands quite frequently and for the recommended 20 seconds. Cleaning and disinfecting surfaces in the home with at least a 70% alcohol solution or other disinfectants quite regularly, wiping down commonly used surfaces, avoiding touching your nose and eyes and mouth, self-inoculating yourself. And then I'll say again, one of the questions on here is, can a COVID positive asymptomatic member cook food for non-COVID members? And I'll go back to what I said about Mother's Day. That is, the mothers should rest if they're even asymptomatic and COVID positive, and for 14 days, or as close as possible to 14 days as you can, because we are noticing that some people can be asymptomatic for a while and then quite unexpectedly get symptomatic. And we just want people to take rest, to have your immune system do the work that it needs to do to fight this infection and prevent the spread to other people. And I am concerned about the particulate matter that we generate just by indoor cooking in general. And this may exacerbate to some degree some of the COVID respiratory symptoms. So please, take as much rest as you can if you're COVID positive. And in terms of common mistakes patients and their family members are making, it is just, not taking the precautions that you would if the person was in the hospital, wearing the mask, washing your hands, and staying and providing the social distancing as much as possible. So I'll stop there.
Yeah, there is one question regarding when we are talking about the free airflow in the house, and then we are saying that you should wear the mask. So how do the two contradictory things go together?
Oh, they're not contradictory, I would say. You want the air to go outside. That's why being outside is the most is safest, right? Because then you have the most ventilation. It's when everything is closed up and then you're in a small space and you're sharing that air, that's when you're more likely to transmit to somebody else. But when you wear a mask, then you're not breathing the particles from somebody else. And so you're protecting yourself and you're protecting your family member from getting it from you as well. So they're not contradictory, they go together. Opening the windows and wearing a mask are both
yes.
go hand.
Very rightly said कि जब हम खिड़कियां खोल के रखते हैं, दरवाजे खोल के रखते हैं, तो जो हमारा एयर कॉन्सेंट्रेशन है, जो कहना चाहिए ड्रॉपलेट कॉन्सेंट्रेशन है रूम का, वो कम हो जाता है और इससे हमें बचाव करने में मदद मिलती है। और साथ में जब आप मास्क लगाते हैं तो आप बहुत ज्यादा स्प्रेड नहीं कर रहे हैं, दूसरे की भी आप नहीं ले रहे हैं, सांस के साथ में आए हुए जो भी कीटाणु हैं उनको नहीं आप इनहेल कर रहे हैं, तो आपका बचाव होता है। थैंक यू वेरी मच। एंड विद दिस वी आर इसमें जो था कि पर्टिकुलरली जो नॉन कोविड मेंबर्स हैं या एसिम्प्टोमेटिक मेंबर्स हैं जिनको कोविड हो गया है, उन्हें भी ये ध्यान रखने की बहुत बड़ी बात है कि आपकी सुरक्षा इस बात पे निर्भर करती है कि आप कितनी ईमानदारी के साथ में रेस्ट करते हैं और प्रोटेक्टिव मेजर्स जो हैं उनका फॉलो करते हैं। Now we move to the next slide, which is regarding the relevance of the COVID. Yeah, there is also, it has been found that the patients are usually in a denial mode. They think कि उन्हें कुछ नहीं हुआ है, कुछ नहीं है, और जितने भी देर तक वे घर में रह सकते हैं वे अपना ट्रीटमेंट अवॉइड करते रहते हैं। एक तरह से जैसे कबूतर वाली स्थिति हो जाती है, बिल्ली देख के जो आंख बंद करके बैठ जाए कि बिल्ली तो दूर है और मैं प्रोटेक्टेड हूँ, तो वो बिल्ली झपट के खा जाती है। वैसे ही हालत होती है इनकी कि ये डिनाई करते रहते हैं लास्ट मोमेंट तक, और जब बिल्कुल इनकी हालत ऐसी हो जाती है कि किसी भी तरह से आराम नहीं मिलता है, तब ये हॉस्पिटल में एडमिशन लेते हैं और लेट एडमिशन के कारण इनका इलाज ठीक से नहीं हो पाता है और इनकी मृत्यु हो जाती है। तो आप ऐसे लोगों को क्या एडवाइस करना चाहेंगे और क्या कहना चाहेंगे?
Yeah, I mean, for that, I would say really, that's why getting the oximeter at home would be very, very important. And if somebody is getting more short of breath with very minimal exertion, I've seen people, get so winded just from turning over in the bed. Or if they start to get pain with deep breaths, and we're concerned about chest pains and blood clots because they're at risk for blood clots. Those are the people really who we should be looking for a hospital bed and really getting them there sooner. And then sometimes people tell me, oh, it happens here too. Oh, I was too sick to go in, so I didn't go into the hospital because I felt too sick. And that, we can't let it get that way really, because if people are starting to really have oxygen saturations that are in the 80s, not able to catch their breath, having these chest pains, we really need to do everything we can to get them further evaluated.
Very true. So इसमें हम यही कह सकते हैं कि जैसे गैस के सिलेंडर, गैस व्हेन वी आर ऑन हो जाए या उस पे आपने दूध रखा है और वो उबल जाए, तो इट्स बेटर टू ऑफ द स्विच एंड देन टू टेक केयर ऑफ इट rather than just looking for it that okay ये उबल के नीचे ही आने वाला है. तो इसी तरह से कोविड सिम्टम्स को इतना ना बढ़ने दें कि वे जानलेवा हो जाएं. आपको तुरंत ही इसमें अपना जो भी निर्णय लेते हुए मेडिकल हेल्प के लिए आगे आना चाहिए. Next. Now here is what is the relevance of the key markers for determining the severity of the infection, and because it has been seen that these markers, they are very costly. So are they really needed, and what is the interpretation and the accepted range of these markers?
Yeah, here we hardly use them. Sometimes we use them, we often do order them in people with severe COVID when they're coming into the hospital, but we don't really use them to make a distinction on how we're treating patients. We really go by their pulse oximeter and how they look to decide whether how much oxygen they need, whether they actually need intubation, and then and giving them dexamethasone and other treatments in the hospital. We haven't found these markers very helpful. So I would say that if given the cost, I would not recommend drawing all of these. The CT can be helpful, especially when somebody is worried about blood clots. And as I said, if somebody has pain with deep breaths, then that could be helpful. If there's concern for a secondary bacterial pneumonia, then that can be helpful as well. But in the majority of people, you don't need the CT, but I know that it's being used. Sometimes it's easier to get than the COVID test. So people are getting a CT, but I would say the majority of these aren't really necessary.
Okay, very rightly said, Dr. Aruna, all these tests, though they are the inflammatory markers and they show whether the person is having the inflammation and what is the grade of inflammation, but still, the clinical judgment is the best judgment to guide and to mark whether the person needs and what level of treatment is required. However, if these tests are available, we can get them as per the directions of the treating person and not as per your own whims. And if suppose your HRCT values are decreasing or they are problematic, then don't get worried. Let the doctor decide what to do, not the person.
Right.
Next, please. Now, as we are seeing that patients have been discharged from the hospital and then later on within 10 or 15 days, they fall sick again and sometimes they succumb. So what are the post-COVID sequelae and the complications you think one should take care of regarding the prevention and the management, and are they lifelong disability?
Yeah, so this is learning a lot about right now. There are some post-COVID sequelae that can be prevented. Some of them are more related to the acute infection. So especially now with use of steroids, we have to avoid overuse of steroids. I've heard people giving very, very high doses for much longer periods of time than is recommended. So then people are at risk for secondary infections, bacterial, and even some mold infections we're seeing. And some of those are causing unnecessary post-COVID sequelae, long-term in people's lungs. So there are those immediate consequences. Then the consequences if somebody has pneumonia and that slow recovery, it can take a long time to really recover from the acute sequelae. So those are all issues that are related to the acute process. Then there's something different that's called long COVID syndrome that we're seeing that can last several months, even up to a year after COVID-19. That has more to do with fatigue, headaches, and other sort of different organ systems are involved. There's some neurologic symptoms, brain fog, and even some GI symptoms. Those can be long-term, and that can even be in people with mild disease. Thankfully, that's in a very small percent of people that have ongoing symptoms, and we are studying and learning about it. Go ahead.
Oh, sorry to interrupt, Dr. Subramanian. I just wanted to point out that we have about 10 minutes left, and I wanted to make sure that we address some of the questions about COVID and pregnancy and breastfeeding, especially since we have Mother's Day coming up. So there are questions about whether vaccination is safe and effective in pregnancy, and I'll start, and Dr. Subramanian, please chime in. So there is no data to suggest that the vaccines are harmful in pregnancy at all. And as a matter of fact, there have been some large registry studies that have looked at women who have been vaccinated pre-pregnancy and early in their pregnancy. And fortunately, we have enough data now that there are some births that have shown no adverse effects. So please get the vaccine if you're offered, and it is an individual decision still if you would like to get the vaccine, but there's no evidence to say that it's harmful. And breastfeeding is also not found to be harmful in those with COVID, nor in those who have gotten the vaccine. And then I'll just let Dr. Subramanian add to that.
Yeah, no, it especially if you've had the vaccine and then you're breastfeeding, there's evidence that you actually give those protective antibodies to your baby. So you're providing further protection for the baby. So that can be a very positive thing. And I think, Dr. Rashmi, you're OBGYN, right? So I don't know if you're recommending.
Yeah. Yeah, there have been cases where the COVID patient had delivered and the baby has turned out to be COVID negative. So it shows that it does not have much effect. So we can give the vaccination to the pregnant as well as the lactating mothers. There was one query from the audience that whether we can give the vaccine to the under 18. Is there any criteria for not giving to under 18?
So I think that the vaccines that are available in India right now, Covaxin, Covishield, and even Sputnik, I think were only approved for 18 and older. But I think if you get Pfizer available there soon, that's been studied in 16-year-olds and up, and hopefully pretty soon will be also approved for 12 to 15-year-olds. So it's really a matter of the regulatory boards and their oversight deciding on if they have enough data. But so far it looks like, all of our studies in young kids, we even have a study here at Stanford of 2 years old and up who are getting the Pfizer vaccine, and that seems safe. So I don't think there'll be a problem with the younger ages, but I think they're really concentrating on the highest risk people. And as you know, the older you are, then the higher risk you are for getting more severe disease. So that's why it's really important that we save the vaccine. If there's limited vaccine supply, then the older people should really take precedence on who gets allocated, and the kids can get it later as there's more supply.
Yeah, very rightly said. Now, there was another question that regarding the vaccine side effects, or what are the side effects of the vaccine which are considered as normal, and what are the complications which one should take care of, one should know?
Yeah, the main side effects of the vaccines are really very minor. They're arm pain, fever, sort of cold-like symptoms, and a headache. Really things that you can take paracetamol or Brufen for and get over it in 2 or 3 days. So the majority of people, millions of people have gotten these vaccines and not had any problems. There have been some rare side effects, rare allergic reactions that have gotten a lot of press, very rare blood clots that happen. But when you look at actual COVID-19, the rate of blood clots are so much higher that the vaccines are very, very safe when you look at that. And even the allergic reaction to penicillin is log-fold more common than allergic reaction to these vaccines. So I would say that, we hear these, it gets blown out of proportion in the media, but the vaccines are extremely safe and really very mild symptoms, as with any vaccine, for a couple of days.
There is another query by the audience, that whether a vaccine can be given to the person who is already infected with the COVID.
Wait, sorry, Dr. Lata, did you want to add something to the vaccine thing?
No, I was just going to sort of mention that we have about 7 minutes left, and maybe we could make some closing comments, but I'll sort of answer the question that Dr. Jain just asked about whether someone who has had COVID can get COVID vaccine. And what is recommended in the US is 90 days after a COVID infection, it's okay to get the vaccine. And what we're finding is that people who have been infected with COVID and then get the vaccine sometimes have more side effects, so more tiredness, more perhaps fever, chills than people who have not been exposed to COVID before. So I wanted to,
can I just make one comment on that? The 90 days recommended by the CDC was because we didn't have enough vaccine available, and the thought was that you have protection for those 90 days. So if you're offered vaccine sooner than 90 days, you can go ahead and get it once you are feeling better and your symptoms have resolved. So you should be out of the quarantine period and your symptoms should have resolved. And if you have access to the vaccine and it's not in short supply, then you can go ahead and it's safe for people to get it. And getting the vaccine after you get COVID is beneficial because you get more antibodies, you get more immune protection when you get the vaccine after COVID. So people should get the vaccine, whether or not they had COVID previously.
So I just wanted to start making some closing comments, and then maybe Dr. Aruna can make some closing comments, and then Dr. Jain, if you can finish off the session, that would be great. I want to emphasize that 98% of people who are positive, have a positive COVID test, generally do fine. So I want to emphasize that the majority of people who get sick with COVID will do fine. And we have mentioned some key things to look out for in terms of triaging and getting people to the hospital. So this includes pulse oximetry of less than 90%, not being able to speak in full sentences, basically, if you're feeling more unwell, of course, go to the hospital, but many people can convalesce with this at home. A majority of the people can convalesce at home. And I also want to point out that this is a very tough time in India with 4,000 deaths a day, but to remind us that the US was in this same spot, 4,000 deaths a day. last December, January timeframe. And the US is a country a third of the size of India. And we're aware that the deaths and infections are vastly underreported, but this is something that, that can be dealt with and tackled with the public health measures that India has been so wonderful at implementing in the first year of the pandemic. So I am confident and optimistic that that we'll see the other side of the surge in India as we have in many other places around the globe. So with that, I'll turn it over to Dr. Subramanian.
Yeah. And I always say we shouldn't forget the healthcare providers and really make sure that they have enough support because it can be really, really hard on them. You know, trying to deal with all of this can be very, very hard, and it's scary for everybody. So making sure they have enough protective equipment, they have the resources, and you know, and as they're triaging people, really we have to give them enough leeway to choose who really needs to come to the hospital, who really needs to get the hospital bed. And I've heard of, you know, patients getting angry or feeling that, you know, their parent should be prioritized, and it really has to be based on clinical symptoms and equity, and that's what we really we have to be very understanding of the healthcare providers, and also mental health is a big issue in you know, we've seen depression and other things in our healthcare providers and people on quarantine. So I think all of that, taking away the stigma of those things and allowing people to open up and talk and get resources and support is very important.
Thank you, Dr. Aruna. Very rightly said कि कोरोना होना टीबी होना जैसा नहीं है कि एक स्टिग्मा लग गया आपके चेहरे के ऊपर, या एड्स हो गई है तो एक स्टिग्मा लग गया। कोरोना एक फ्लू जैसी बीमारी है जिसमें 98% लोग बाग ठीक हो जाते हैं, सिर्फ 3% या 2% जो है उनको ट्रीटमेंट की जरूरत होती है। और ये हमारे ऊपर निर्भर करता है कि हम अपना मानसिक संतुलन बनाए रखते हुए किस तरह से एक सकारात्मक सोच के जरिए, सकारात्मक कार्य के जरिए अपने आप को और अपने देश को स्वस्थ रख पाते हैं। तो हम बहुत आभारी हैं आप दोनों, हमारे जो अतिथि गेस्ट हैं जिन्होंने इतना काम किया है कोविड के ऊपर और हमारे यहाँ फैली हुई भ्रांतियों और अफवाहों को दूर करने में मदद की है। अब मैं सोमनाथ चैटर्जी जी को यहाँ पे इनवाइट करना चाहूंगी कि वे आए और हमारे गेस्ट को यहाँ लाने में जिनका बहुत बड़ा योगदान रहा है, वे उनके प्रति 2 शब्द कहें। डॉक्टर सोमनाथ जी।
Thank you, Rashmi ji. This is just to offer my heartfelt thanks to Dr. Lata and Dr. Aruna. It's amazing. I mean, we could cover so much in 60 minutes. It's just captivating, and we could cover so much of diverse topics. This is certainly going to be available to participants. I could see a lot of demand for this video because people want to see it again and again. I'm sure there are a lot of points they want to go over. This is like a prescription which needs to be, you know, mulled over well, and, you know, and also circulate. So there are a lot of people who have been thoroughly engaged asking questions. So thanks to them. And of course, my hearty thanks once again to Dr. Lata and Dr. Aruna for agreeing to be with us at such a short notice and being with us through and doing all the background work in terms of the questions that we collected, the question box that we created, just to make it interactive and to make sure that we reach out to as many people as possible. Thank you.
Thank you so much. और हम अपने पार्टनर्स को कैसे भूल सकते हैं? हम अपने जो हमारे IWC के जो पार्टनर्स हैं, जो हमारे एक तरह से बैकबोन रहे हैं, उन सब का आभार मानने के लिए मैं विंग कमांडर काला जी को आमंत्रित करती हूँ। काला जी।
Thank you so much, Dr. Aruna and Dr. Lata, for giving so much time to us and taking care of a lot of questions that were there in people's mind. We would now like to thank our strategic knowledge partners, which is IHMR University. Then we have community partners in MF, JCF, Organ and Tissue Donation Project, Bitosa Jaipur, Jewelers Association Jaipur, RCCI Rajasthan Chamber and Commerce Industry, SKIT, SMDG Alumni Association, Employers Association of Rajasthan, IIS Jaipur, Life Shiksha. Our corporate wellness partners are KP Automotives, Pratham Software, Data Infosys Limited. Our NGO partners are Udan NGO and Raksha. Our wellness partners are CK Birla Hospital, Area Development Partner Shamnagar Vikas Samiti. We are then pro bono partners in Global Answers for IT support, Sandeep Bansiwal, Mr. Surendra Shah and Associates, Mr. Pratik Jain, Creations Adda, Satvik Foods, and then our ambassadors, Major General CP Singh, Mrs. Neeta Bushra, and Mr. Mahavir Sharma. So thank you so much. And then finally, how can I forget my team? You know, we have the management team consisting of Mr. Bakshi, myself, and Mr. Somnath Chatterjee, whom we just heard. And then we have our support core team, Jitendra Gautam, Harminder Multani, Adu Gurudas, and Arushi. Then we have our staff, a team of doctors, Dr. Sheila Nambia, Dr. Sudhir Bhandari, Dr. Sunil Jain, Dr. Rashmi Jain, Dr. Chavi Mehra. And then we have our support team. Go to the support team, Yup, Sneha Vasis, Smriti Meghwal, Devinder, Tushar Garg, Umardin Khan, and Rishish Surana. So Dr. Aruna and Lata, just to tell you, this is the team that we have supporting this whole wide initiative. And we really enjoyed having you on this session and learning so much from you. And we hope and look forward to more patronage from both of you and from Stanford going forward. Thank you so much. And thank you everyone for being here with us. Our next webinar, May 16, is Nutritious Diet. We are fortunate to get Mr. L.M. Kapoor to talk on, diet issues and how it can help us in current times and in general in our life. Then on June 6th, we have a topic on resilience. We just now heard, that mental issues are going to be there going forward because of all the suffering that we are inculcating now. So there's a presentation on that on June 6th. And then on June 20th, we are talking about be updated with your smartphones, because we are talking of overall wellness in our concept, not only physical wellness, mental, emotional, technological, financial, legal. So these are some of the webinars that we are lined up for you, and maybe there's more in as we go forward. So thank you so much for being with us. Thank you.
Okay.
Hello.
अपने
Now
स्वास्थ्य की
cleaning
देखभाल
state.
करो, क्योंकि ये वो जगह है जहां तुम्हें हमेशा रहना है। इंसान अपने जीवन में चाहे जितनी भी धन दौलत सुख साधन की प्राप्ति क्यों ना कर ले, लेकिन उसका स्वास्थ्य ही उसका सबसे बड़ा धन होता है। ये कहावत सुनी हम सब ने है दोस्तों, लेकिन आज की तेज रफ्तार दुनिया में ऐसा लगता है कि ये बात हम कहीं भूल गए हैं। आज की दुनिया में हमारी कल्याण से रिलेटेड 70% समस्याएं लाइफस्टाइल के कारण होती हैं। इन्हीं सब समस्याओं से लड़ने के लिए क्रैक द वेलनेस कोड यानी कि CWC की शुरुआत सिलिकॉन वैली में की गई थी। CWC यानी कि क्रैक द वेलनेस कोड, ये एक नॉन पॉलिटिकल और नॉन रिलीजियस ऑर्गेनाइजेशन है। ये हर उम्र के वेलनेस यानी कि खुशहाली को प्रमोट करने की कोशिश करता है। CWC पूरे सैन फ्रांसिस्को बे एरिया में एक जबरदस्त वेलनेस मूवमेंट के तौर में फैला है। सिलिकॉन वैली में अपने जबरदस्त काम से CWC ने देश विदेश में रहने वाले ना जाने कितने लोगों की जिंदगियां बदली हैं, और अपनी इस अपार सफलता के बाद अब CWC इंडिया में आ रहा है IWC के नए रूप में। IWC यानी कि इंडस वेलनेस कोड ट्रस्ट। वेलनेस का मतलब होता है कि हम अपने रोजमर्रा के जीवन में ज्यादा से ज्यादा अच्छी आदतों का प्रयोग करें, जिससे कि हमारी फिजिकल और मेंटल हेल्थ अच्छी रहे। स्वस्थ तन में ही रहता है स्वस्थ मन और विचार। अगर चाहते हैं खुश रहना तो ना होने दे इसे बीमार। अगले 5 सालों में IWC कम से कम 50 लाख देशवासियों की खुशहाली बढ़ाने का काम करेगी। इस मुहिम में सफलता के लिए हमारा मंत्र है एडुकेट, इंस्पायर, एम्पावर और इम्पैक्ट। एडुकेट यानी वेबिनार्स के जरिए हम आपको एक्सपर्ट से जोड़ेंगे जो कि आपको वेलनेस के विभिन्न आयामों पर जानकारी देंगे, और इस जानकारी को अपने जीवन का हिस्सा बनाकर आप एक स्वस्थ और बेहतर जीवन जी सकते हैं। इंस्पायर यानी डॉक्टर्स, प्रैक्टिशनर्स और हमारे हेल्थ हीरोज के सपोर्ट से आपको वेलनेस के लिए प्रेरित किया जाएगा। एम्पावर यानी कि पार्टिसिपेंट्स को सपोर्ट ग्रुप्स, वेबिनार्स, वेलनेस रिसोर्स सेंटर और भी अन्य प्रकार की एक्टिविटीज से वेलनेस को अपने जीवन का हिस्सा बना सकते हैं। इम्पैक्ट, यानी कि आप ना केवल अपनी खुशहाली के बारे में सोचें परंतु कुछ करें भी। इंडिया के इतिहासों में पहली बार एक वेलनेस रिसोर्स सेंटर खोला जाएगा। वेलनेस रिसोर्स सेंटर एक ऐसी जगह है जहां आपको कल्याण के 10 आयामों से संबंधित किताबें, वीडियो फिल्म्स और ऑडियो लेक्चर्स अवेलेबल होंगी। ये सब ज्ञानवर्धक ज्ञान का भंडार डॉक्टर्स और हेल्थ प्रोफेशनल्स द्वारा सुझाया गया है। इसके अलावा यहाँ पर हम शुरुआत में कल्याण के कुछ आयाम जैसे कि योग, हेल्थ कुकिंग, एसेंशियल टेक्निकल स्किल्स, इमोशनल हेल्थ पर सेशन शुरू कर रहे हैं। ये वेबिनार हफ्ते में एक बार होगी दोस्तों। जो कोई भी यहाँ पर आकर इन सेशन में शामिल होना चाहता है वो हमारी वेबसाइट thewellnesscode.org पर जाकर रजिस्टर कर सकते हैं और बाकी लोग इन सेशंस में ऑनलाइन शामिल होकर लाभ उठा सकते हैं। IWCT खुशहाली के 10 आयाम कार्य करेगी। ये आयाम है फिजिकल वेलनेस, मेंटल वेलनेस, इमोशनल वेलनेस, स्पिरिचुअल वेलनेस, बिहेवियरल वेलनेस, ऑक्यूपेशनल वेलनेस, कल्चरल वेलनेस, फाइनेंशियल वेलनेस, इंटेलेक्चुअल वेलनेस एंड सोशल वेलनेस। धीरे धीरे हम इसमें और भी विषयों पर कार्य शुरू करेंगे। दोस्तों, आज इंडिया ग्लोबल वेलनेस इंडेक्स पे 156 कंट्रीज में से 140वीं रैंक पे आता है। आपको और हमें स्वस्थ आदतों का निर्माण करके और कराकर इसे बदलना होगा और इंडिया को एक वेलनेस इंस्पिरेशन बनाना होगा। तो चलिए मिलकर ये वेलनेस यात्रा की शुरुआत करते हैं दोस्तों।